This is your video lecture for Chapter 37 out of your Modern Dental Assisting book. And in this chapter, we are going to specifically look at the anesthetic syringe and its contents. So if we're looking at the syringe, we have a couple of areas that we want to focus: the thumb ring and finger grasp. These parts allow the dentist to control the syringe firmly and aspirate effectively with one hand. Next, you see the harpoon. This is the sharp hook that locks into the rubber stopper of the cartridge. So the stopper can be retracted by pulling back on the piston rod, and this action is what makes the aspiration possible. The piston rod is the rod that's going to push that rubber stopper of the anesthetic cartridge and then force the anesthetic solution through the needle. The barrel of the syringe is going to firmly hold the anesthetic cartridge in place. The cartridge is loaded through the open side of the barrel. There's a window at the other side that's going to allow the dentist to watch for blood during the aspiration. And the threaded tip or the needle adapter is at the hub of the needle, and that is how it's attached to the syringe on the threaded tip. We look at these areas here in this photo. Here we have the threaded tip. That's the harpoon that goes into the rubber stopper. Next, we see the piston rod. 4 is showing the barrel. 5 here has the finger grip and the finger bar. And then we have our thumb ring. Next, we'll talk about the cartridge itself. So our anesthetic solution is supplied in glass cartridges. They have a rubber stopper. And then also on the other side, opposite of the rubber stopper, we have this aluminum cap. Cartridges are going to be supplied in blister packs, which are already sterilized, and they are stored in a sealed environment. Anesthetic comes with a color coding. It's designed by the American Dental Association Council on Scientific Affairs, and they've created a standardization for all injectable local anesthetic products. So if you take a look here, all your lidocaine with epinephrine is going to have the color red. If we're looking at mepivacaine, 3% plain, they have this brownish color. We want to learn to identify these color codes and always take care to select the ratio specified by the dentist. Also, always take precaution to double check the patient's record before we make any anesthetic selection. We want to make sure that they don't have any allergies. Some of our guidelines. So our cartridges should be stored at room temperature and protected from direct sunlight. Heat and sun may cause the solution to weaken and be less effective. We're never going to use a cartridge that's been frozen. We're not going to use the cartridge if it's cracked, chipped, or damaged in any way. We're not going to use it if it's discolored or cloudy. We're not going to leave the syringe preloaded with the needle attached for an extended period of time. And once the needle and syringe have been assembled, the cartridge must be used or discarded. And we're never going to reuse cartridges. The disposable needle is a sterile needle used for injection. It's protected by a 2-part plastic covering. The outer plastic casing consists of 2 parts that are sealed together to ensure that they're sterile, and the needle should not be used if the seal is broken. The cartridge end of the needle is the shorter end, and it fits through the threaded tip of the syringe and punctures the rubber diaphragm or the anesthetic cartridge. The hub is made of a self-threading plastic or pre-threaded metal, and it's used to attach the needle to the threaded tip of the syringe. And then we have the injection end. This is protected by the needle guard, and it's 1 inch or 1 inch and 5/8 in length. It's common practice for the 1 inch short needle to be used for infiltration of anesthesia, and then 1 5/8 inch to be used for block. The end of the needle is going to be beveled. Before injection, the needle is turned so that the beveled angle is toward the bone. This angle enables the dentist to deposit the solution next to the bone without actually contacting the bone.